There is no doubt we are going to have to shutter some services in order to make this work. We will do our best to keep you apprised of these matters as we get to them. These decisions will be based on an ethical framework and will ensure fairness across programs to the greatest extent possible.
The mobile health unit is provided by Weatherhaven is the vendor. It's one of 2 health units that will be erected in the province. The other is in Sunnybrook. It is a fully self-sufficient unit. Up to 80 patients can be accommodated in the unit. And it is self-sufficient in the sense of water, waste, energy, etc. It does support COVID and non-COVID population, and we are planning for those populations right now. Looking at patients with a length of stay that's on the lower range of 3 to 5 days, no critical care patients, and we are not intending to put ALC patients in the MHU either.
A lot of work done last year to actually create an ethical framework for how we would classify procedural activity. And basically it's a 1 to 7, that framework. And what we are doing, we're going ahead with classes 1, 2, and 3A. So across all of our procedures, both ORs and endoscopy, HIU, etc., we are looking at reducing activity to make sure we can maintain those 1, 2, and 3A activities.
So we're now at the place where we are using this framework to evaluate how we will adjust ambulatory services in order to free up what right now is the most needed resource, health human resources for our critical care and also for ward care.
The reality is the patients are coming, so we're with folks trying to move as quickly but as safely as possible. We've had some staff already starting from the perioperative and procedural care areas, and we're very grateful for their support, ambulatory care, women's health, ICU, etc.
This is the hospital admission forecast and probably the most important piece for us, but it comes with a very important caveat. This is for Hamiltonians. Now, A, we support the region. B, we support the province. We will probably still see an increase because many of the regions around us are seeing a steeper increase in case numbers than we do currently, and their epi curves will likely look much different. Plus, the weight balancing or load balancing within the province, with in particular ICU patients coming in from the GTA to continue. So with all of this in mind, we will probably continue to see an increase in admitted patients, but not necessarily Hamiltonians.
As always, I want to say thank you to everybody for joining in this common cause and fighting this good fight.